Arkansas is primed and ready to accept healthcare reform, to take hold of the benefits and make them a better place for all Arkansans. Healthcare reform, right now I'm just going to briefly discuss the effects of healthcare reform and how it affects Arkansas, what we're doing, and what we plan to do going forward. So far, healthcare reform, on the day that it was enacted, starting sometime around 2014, we will see an increase in our Medicaid rolls of somewhere between 200 and 250,000 enrollees. As you all know, Arkansas has an uninsured population of around 500,000. So just on day one, January 1, 2014, also known as tomorrow, as many people come to call it, that cuts our uninsured population by half. We've already done great things with our ARKids First program, both A and B. We have a lot more to do, as we talked about today, of what's going on with the re-enrollment process. If you guys can correct me if I'm wrong, I think somewhere around, we're helping with somewhere around 70,000 kids. There are another 40 to 43,000 that we need to try to find ways to help them as well. So you have the Medicaid increase. You have, starting this week, individuals with children that are still in college are still trying to find their way out of college. Seriously. They are now able to stay on their parents' health insurance program until the age of 27. So that's another positive. And so it helps with, in this down economy, they're still able to take care of health care for their children. Another great aspect of it are the small business tax credits that are going to really help out all the small business folks as far as getting them more dollars into their actual bottom line, as far as providing health care, because most and not all provide health care. So actually we're going to force people to provide health care, which is a good thing, because if you know one thing about Governor Beebe, his two hallmarks of his administration is education and economic development. But we all know health care sustains those two. You can't have a smart student unless they're healthy. You can't have a smart and productive workforce unless they're what? They're healthy. And from my knowledge, a lot of small businesses and big businesses, at least a quarter of their bottom line is health care. And so those are the positive things I don't think out in the public people are really discussing. I will say this, that Governor Beebe has adamantly spoken out in the public about he wishes that healthcare reform would focus a little bit more on cost containment. What we can say is that healthcare reform has done a great deal in access. Governor Beebe, along with his healthcare cabinet, some people are here today, I just want to recognize them. Eugene DeSalle, he's running our Medicaid implementation of these new 250,000 people. I just want to recognize Jean. Janie Huddleston, she's taking care of all of the DHS components of the healthcare reform. She's an all-in And Lowell Nichols, who's here today for the Arkansas Insurance Department, he's been the lead staffer on a lot of the things I'm going to go into later as far as what Arkansas is doing. Actually, most people don't know the insurance department is going to play an integral role in healthcare reform. And it's just going to be very interesting. But the main thing is, most states commission the staff. Governor Beebe believes in empowering his folks. So he has a healthcare reform cabinet. That cabinet hasn't been formally commissioned. It won't be formally commissioned because he believes it's a part of their duty to take this law, find all of the benefits for our Arkansans, go after those dollars, and make sure we implement it in a cost-effective manner. That's what they've been doing. So far, over the last 4 or 5 months, we've received several grants. We received somewhere around $300,000 to $400,000 for a consumer navigation grant, which is going to be housed in the Arkansas Insurance Department. We received a ombudsman grant, which is around $200,000 to $300,000. It's more on the consumer and constituency efforts of the benefits exchange and things of that nature. We just submitted another application of $1 million for the planning grant for the health benefits exchange. And what that looks like, guys, is the health benefits exchange is really a stock market of all the health insurance plans. And so we've already talked about the 200 to 250,000 that are going to be on Medicaid. There's also going to be an avenue for individuals who opt out of their health care insurance from their employers, or if their employers decide not to do it, what have you. So I think it's going to be somewhere around up to 400% of the federal population. And those individuals will be able to go to this stock market of health exchanges, of health benefits and try to figure out what's best works for them in their household. And so we're going to take the opportunity through the Health Benefits Exchange Planning Grant process, which is $1 million that we should be receiving. We're going to collaborate with the Healthcare Reform Cabinet to figure out where best to house that organization. We all know that Medicaid is going to be a huge player in healthcare reform. They're going to be a huge customer. And there are a lot of things that we're going to have to figure out down the road, and we look forward to that challenge. There's just so many things, not just access, and while it may not necessarily discuss cost containment, when we talk about IT is a form of cost containment. It's one of many tools to create efficiencies for the healthcare reform process. Not related to healthcare reform, actually several months before healthcare reform was enacted, I call it President Obama's way in for healthcare reform, was the Health Information Technology Plan. Basically, this plan is to, for every state to facilitate a health information exchange, which is an information highway for electronic medical health records to be felicitated to and from for each individual person. It's a way to talk interoperability within states, within counties, within cities. So many times, most people don't know, if I move from Little Rock to Dallas, I literally have to go get my healthcare folder and take it with me. And so we're going to cease that process with EHRs and the HIE. So you have that aspect. You have the Health Benefits Exchange, which is another IT system. Oh, by the way, Arkansas, we're now in a re-procurement phase for our Medicaid Management Information System, which is the claims processing component, among other things that it does. It's I think one of our largest RFPs out in the state these days. And so it takes care of the financing of healthcare reform as well. And so as these three IT systems come together, we're working collaboratively to make sure that we can converge them. In an ideal world, we wish we could have one system for all three. However, I don't think that's going to be possible. But what we do want to make sure is that they're all able to talk to one another. And that they're all able to make sure that we cease any duplicative efforts that cost the state money. But not just cost the state money, but we want to make sure that we move from a fee-for-service model to accountable care organization in our state. And what that does is it takes away the financing piece and focuses more on the quality. And so what is that? It's better for all of our states. We've done a lot of great things also with IT, with UMS just receiving their Broadband Technology Opportunities Grant Program, which is going to also create another information highway for x-rays and data imaging and things of that nature for our rural communities, which need it a lot. Right now, the savior of our rural communities have been our community health centers. They've been the major safety net provider for us, and we appreciate them for that. And really at no cost from the state, because they receive most of their dollars from the federal government. Recently in the 2009 legislative session, Governor Beebe was able to give them some dollars. Not only was Governor Beebe with off of the legislature, but the governor passed his health care initiative program, which is actually in the whole South one of the most comprehensive health care initiative programs in this last decade. That program not only took care of community health centers, it created the hallmark of that legislation with the trauma system. It presented funds to more than 23 programs, a lot of funds that are the efforts and one of the advocacy efforts of the Arkansas Advocates. And I also want to publicly thank Arkansas Advocates because they were a major player in making sure that we got that vote passed. And so I can talk day in and day out about healthcare reform, HIT, stimulus and other things, but I just want to leave this time for you as we get closer and closer to lunch. Then we have enough time for questions as well.